Assalamu alaikum. This is Moyed again, the founder of the Golden Board of Urology, which is a series of videos where we will discuss every case scenario that could come in any final urology board exam. And as usual, apart of helping the resident passing the exam, the ultimate goal behind creating this series is to spread knowledge and experience aiming to improve the patient's care around the world. Today, I have a new idea that I think it will help whoever wants to test himself without the need of any study partner. Okay, tell us how. I'll tell you how. I'll read the case scenario, and if you want to test yourself, all you need to do is you can pause the video after every question and answer it. Then resume it to the next question when you are done. But please note that you'd better set the timer for 10 to 12 minutes maximum and try to challenge yourself not to exceed this time limit, as if you are in a real OSCE station. And toward the end of the case, I'll show the key answers, and you can just screenshot them and compare your answers to them. And I would suggest also if you can record yourself so you can compare your answers with the key answers. By this way, whoever doesn't have any study partner can practice alone. By this way, you can just test yourself multiple times without the need of a study partner. I think this is such a great idea. So let's get started. 65 years old gentleman presented to your clinic with poor urinary stream that's affecting his quality of life. What is your approach? You can pause the video. The patient has hesitancy, poor stream, and sense of incomplete emptying. No significant irritative symptoms, and he underwent resume 2 years ago. There was no any clear improvement of his symptoms after the resume, and the symptoms are getting worse now. Worth mentioning that he's still on Omnic and Proscar. What next? Physical examination was unremarkable, and he refused digital rectal exam, and his external genitalia examination was unremarkable. What laboratory work you will order for the patient? Creatinine is normal. Urine analysis showed microscopic hematuria. PSA is 1.6 nanogram per deciliter. What is his PSA density? Is it significant? What next? Cytology is negative. Cystoscopy showed enlarged prostate. Ultrasound KUB showed a remarkable upper tract. Post-body residual was 150, and prostate size was 70 cc. Uroflowmetry was done and showed the Q max of 6 ml per second and voided volume of 300 cc. What's your impression? Urodynamics was done as well and showed the following. Could you please list 4 positive findings? What are the indications of upper tract imaging in this case and in men with lower urinary tract symptoms? What are the indications of pressure flow study in this case and in men with lower urinary tract symptoms? How to calculate bladder outlet obstruction index and how to interpret the result? How to calculate bladder contractility index and how to interpret the result? The patient has a normal compliance, Q max of 5 cc per second, and PVR of 120 cc, and he is obstructed. He has adequate detrusor contraction. And could you please tell me what's the best treatment option for him? Mention 5 complications of TURP other than bleeding and infection. Thank you. Now I'm going to show the key answers.